All right, we have a big update on Brock Purdy's upcoming surgery to repair his torn UCL. At last, a date is set. This is according to Ian Rappaport of the NFL Network. February 22nd is the expected surgery date, and it's going to happen in Arlington, Texas, just outside of Dallas, right where the Cowboys play. The doctor is going to be Keith Meister, who is the Texas Rangers team physician, and he is an elbow/UCL expert. This all makes sense because the injury that Brock Purdy suffered is much more common in baseball, and Meister is actually an expert at elbow reconstruction and different elbow surgeries. Now, it should be noted that this is not Tommy John surgery for Brock Purdy. This was expected, but it still is significant. Tommy John surgery, which Dr. Keith Meister has extensive experience in, would sideline Brock Purdy very likely for the entire 2023 season. Recovery time can be a year and a half with Tommy John surgery. But there's a newer technique called the internal brace technique. And based on the timeline that Ian Rappaport reported today, he said that Brock Purdy would make a full recovery in time for training camp. That means that the 49ers and Brock Purdy and medical personnel have decided to go with the internal brace, the newer technique, and not full reconstruction Tommy John surgery. So the timeline, according to this, is about 3 months for Purdy to resume throwing and about 6 months for him to return. It is unclear if that's from the time of injury or from the time of surgery. I think it's probably somewhere in between. But the thing is that swelling has to subside before the 49ers and Brock Purdy are okay with going ahead with surgery, because you want the swelling to be as low as possible to make the chances of a successful surgery to be as high as possible. So the Purdy path is swelling fully subside. February 21st, he's going to fly out to Texas, to Arlington, and he's going to meet with Dr. Keith Meister so that they can take a final look before Purdy does go under the knife. And then on February 22nd, the surgery is tentatively scheduled to happen. Under this timeline, 3 months from now is May. That's when Purdy would resume throwing. And then training camp, which starts in late July, early August, that's when Purdy would be full go cleared for practice. So again, Brock Purdy, February 22nd, surgery. Based on the Rappaport report, this is heading the way that the 49ers expected it to, the way that Purdy expected it to when we talked about a week ago, and that is the way of the internal brace technique. This is not Tommy John surgery that had been incorrectly reported on Twitter. Big surprise, Twitter incorrectly reporting something. This is the less severe of the two options, which is obviously good news for the 49ers and good news for Brock Purdy. Still, though, this offseason, the spotlight is going to be on Trey Lance, because we see Purdy's timeline, 3 months to throw, 6 months to return. Well, the 49ers, with this news, I think it's even more likely that they're going to follow the path that they already laid out, and that is Lance and Purdy are their two main attractions at quarterback this next season. I don't think that they want to escape that cost-controlled structure of two QBs on a rookie deal, because they want to make sure that the rest of the roster is as robust as possible under the salary cap. So expect the 49ers to bring in a veteran this offseason, but don't expect them to bring in a veteran that A, breaks the bank, and B, upsets the QB pecking order that they currently have right now. It's Lance and Purdy right now, with obviously Purdy being not healthy, not ready to go. So Lance is going to get the lion's share of the spotlight this offseason. And then Purdy will have a chance to come back in at training camp if all goes well with this surgery. And we can see where the competition goes from there. Trey Lance actually at the Super Bowl today had a good interview with Rich Eisen, where he talked about embracing the competition. He doesn't expect anything to be handed to him because of how well Brock Purdy played this past season. And that's the way that it should be. QB option power is what the 49ers have striven to build. QB option power is what they're going to have if Brock Purdy's surgery on February 22nd does go well. So Lance in the spotlight now. Purdy can re-enter the spotlight later. This, I think, is a best-case scenario for the 49ers after Purdy had reportedly torn his UCL. The fear when the UCL tear diagnosis came back via the MRI on the day following the NFC Championship game loss to Philadelphia was that Brock Purdy would need elbow reconstruction surgery, which is Tommy John surgery, and he would miss the 2023 season. But other 49ers quarterbacks, or one other 49er quarterback in the past, has gone the path of the internal brace technique, and that was Nick Mullins after he tore his UCL late in the 2020 season. So Purdy is going to go that same path, and he is expected back in time by training camp. Again, it's a baseball type injury, so a baseball doctor is going to perform this. Keith Meister has a lot of experience with baseball players since he's the team physician of the Texas Rangers, and Purdy is going to get this operation in Texas. So that's the update for you. Brock Purdy's surgery coming up on February 22nd. That is 2 weeks from now. We're speaking on February 8th. I'll keep you posted on all of this moving forward. Everybody have a great day. If you have any questions, save them for the Q&A. We're going to have that coming up soon. Everybody like the video, sub to the channel, and talk very shortly. Take care.